The genesis for writing the Mayo Clinic book was twofold. First of all, after I finished my research, my sabbatical research at Mayo Clinic, the senior administrator at Mayo Clinic approached me. And he said, "Len, you know more about the Mayo Clinic now that you've done your sabbatical here than any other outsider. And even though there have been a number of history books done on the Mayo Clinic, there's never been a book written about how we do service. Our service philosophy, our service strategy, our service systems, our service culture. And it would be a great contribution to the clinic itself if such a book could be written, because we get thousands of new employees into our system every year. And it would be a wonderful way to help teach them what the Mayo Clinic is." So that was the first planting of the seed that has now become a book. But I wasn't ready at that time. I just got back from my sabbatical. I wanted to learn more about healthcare. I needed to learn a lot more about healthcare. I wanted to visit other healthcare institutions beyond the Mayo Clinic. Because people had told me, "Oh, the Mayo Clinic is the Mayo Clinic, no one else is like the Mayo Clinic. That's not really healthcare. You need to go out and experience the reality of healthcare in America. The Mayo Clinic is at the extreme." And so I felt that I wanted to visit a lot of other healthcare institutions, and I have in the 6 or 7 years since finishing my sabbatical, all over America. And so I wasn't ready to write a book right away. I wrote some articles about Mayo Clinic. The Mayo Clinic management liked those articles. And I think the articles is what interested them in approaching me to write the book. But the idea, I didn't forget the idea, it just wasn't, the timing wasn't right. And I worked closely with Kent Seltman, who for 14 years was director of marketing at Mayo Clinic. And while I was there and on my sabbatical, we talked about doing something together, some research or writing together when I was finished. And so I approached him when the timing for the book was better. And I said, "Hey, should we do this together?" And several years later, we have a book. And one thing I'd like to add about the book is we did it independent of Mayo Clinic. It's Mayo Clinic was cooperative. They couldn't have been more cooperative. They made their top executives accessible for all the interviews, anything we needed in terms of research. They let us use proprietary research in our book, published in our book. So they couldn't have been more helpful, but we were unwilling to allow them any kind of approval over our book. We're going to write a book. It needed to be a scholarly book. It needed to be an accurate book, an authentic book. It needed to be the truth, to the best of our ability to tell the truth. And Mayo was fine with that. It was, and so I want to make that clear that this is not although Mayo was interested in having a book like this written, they had no control over the editorial content.